What's up, you guys? Welcome back to another video. My name is Giselle and today we are going to be talking about how to approach a patient when you're going into a room, when you're picking them up from the emergency room, when you're grabbing them from the outpatient facility waiting room. This video will help you practice at home so you're ready when you go into the field on how to approach your patients. At the end of this video, I'll tell you about how I would approach the whole situation. So without further ado, let's get started. Now, most likely when you guys are grabbing these patients, you already checked to see if they had any prior ultrasound exams, prior CAT scan exams, MRIs, anything that'll help you figure out this patient's history. You probably already know a little bit about this patient's history, and sometimes they're a new patient and you know absolutely nothing about them. So what you're gonna do when you first get this patient from wherever they are in the emergency room, outpatient facility, or going to their bedroom, you are going to acknowledge the patient. Acknowledging them by saying hello, their first and last name, Miss or Mr., just little things like that. Make it professional. Once you acknowledge them, you want to introduce yourself. So when you introduce yourself, you're going to say who you are and what you're about to do. After you introduce yourself, you want to explain to them the duration of the exam, what's going to kind of happen. You want to explain the test to them, see if they've ever had this done before, ask them a couple questions, and then after you explain the exam, you're going to perform the exam, you're going to do the exam, and then at the very end, you're going to thank them and explain to them how they're going to get the results. Then you leave from there. So it sounds very simple, doesn't it? Well, once you figure out how your flow is going to be, and depending on where you work, it really comes second nature to you. You're going to know how to acknowledge the patient, introduce yourself, explain everything that's about to go on, and thank them all pretty quickly. And it'll all happen within 15 to 30 minutes. Let's go ahead and give you an example of how you're going to do this. First step, acknowledge. Hi there, Mr. Blah. My name is Giselle and your doctor has ordered an ultrasound of your abdomen. Does that sound about correct to you? Now what they're going to do is talk to you, explain to you what's going on. You're going to ask them, what's happening? What brought you to the hospital today? Do you happen to know why your doctor ordered this? So depending where you work, these questions are going to come out differently, but if you already know that the patient is in pain, you can just go straight into, how long have you been having this pain for? Now after they explain it to you and you get all the information that you can, all the history that you can from them, you're going to explain to them the duration of your exam and what you're about to do. So since I'm doing an abdomen ultrasound, I'll say, okay, Mr. blah, 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 I'm going to do an abdomen ultrasound. If you've never had this before, basically what I do is put some gel on your body and take a look at all of your organs like spleen, kidneys, gallbladder, pancreas, blah, blah, blah. Now after you explain that, you ask them, have you had any prior surgeries? Do you have any history with that kind of stuff that I mentioned? So then you can still get a little bit more information from them. And after you explain to them, it may take about 15 to 20 minutes. Is that okay if we begin the exam? Usually they say okay, you just do the exam. After the exam is done, you're gonna help them clean off or give them some towels to clean off. And they'll try to ask you, what's going on? What do I do now? What happens next? That's your time to tell them, okay, the steps that's going to happen next for them. So depending where you work, everything is different. At outpatient facilities, sometimes it takes 1 to 2 business days for them to get the results. And in the emergency room, it takes about 30 minutes to an hour, sometimes even longer for those doctors to read those exams, but they will be the ones to get the patient the exams. So you just explain whatever the steps are wherever you work at. So just for an example, you're just gonna say, okay, Mr. Blah, 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 we're all done with your exam today. I hope you feel better. Your doctor is going to give you the results of the exam here later on today after they read these images. You can also tell them, I can't give you an exact time, but just know that they will give it to you soon. Because a lot of times in the hospital, it takes a little bit longer for them to get the results, and the images itself, they get read pretty quickly, but it's up to the ordering doctor to get the results to that patient. So we don't really know how long that takes on their part, but if you're in an outpatient facility, you most likely can give a more solid answer, like your doctor is going to receive the results in 1 to 2 business days and they will get back to you. Hopefully this video will help you realize that when you're acknowledging your patients, it's going to take some time for you to feel comfortable with speaking to them, but as long as you practice at home, practice with your family, your friends, just practice practice speaking and introducing yourself so that you know what you're going to say to them and that you aren't as nervous going into it. You're also going to follow your preceptors and your mentors, and you're going to see how they do it, how they introduce themselves, how they introduce the exam, and it'll get so much easier at that point. But I just wanted to come on here to help you guys realize that this conversation is very important, because when you approach a patient, that is going to be the start of your exam, and it can determine whether your exam becomes a hard one at the end of the day or if it can just go smoothly. Most people are coming to the emergency room and they're in a lot of pain, so they already know they're going to have some exams and test orders. Some people aren't going to want these exams and tests done, so all you have to do is be like, okay, if you don't want it done, I'm going to speak to your doctor and we'll go from there. You are going to try your best to get that exam done because that is your job, and your job is to figure out what's going on with these patients. So now I'm going to give you a full scenario of what I would say if I was doing a venous ultrasound. I'm just going to use my name for example. Hi Giselle, my name is Giselle and I'm going to do your ultrasound today. Your doctor ordered a venous ultrasound of your legs. Do you happen to know why they ordered that ultrasound? Or in the hospital you would say, your doctor ordered a venous ultrasound on your legs for pain. Are you having some pain right now? What's going on with your legs? And once the patient talks back to you, you make that conversation, you ask history questions, etc., etc. Then I will say, okay, Miss Giselle, I'm so sorry you're going through that, but we're going to try to figure out what's going on. I'm going to do an ultrasound on your legs, and what I'm going to do is start from the groin, going all the way down your leg, kind of pushing down, so please just bear with me. The doctor's trying to make sure you don't have any blood clots, fluid collections, and things like that. So if that's okay with you, I'm going to start. Is that okay? And then you go ahead and do your exam. Finish the exam. Okay, Giselle, so I'm all done with your exam. The doctor's gonna get you the results here in a little bit. If you need anything, please let your nurse know. Or in an outpatient facility, okay, Giselle, we're all done with your exam. Your doctor is going to get you the results in about 1 to 2 business days. You can also check the patient portal if you signed up and acknowledged that you can get your results on that portal. And then you greet them, you tell them have a good day, feel better, hope everything is okay. It can be short and sweet, but there are times where it's a long time because patients like to talk a lot, or sometimes patients give you a hard time and you have to try to figure little things out. But in general, just make sure you're being kind, you're smiling, you are giving them compassion, empathy, you are giving them the best customer service and the best quality care. Because we don't just scan babies and we don't just take pictures, we also have to take care of these patients at the same time and ease their concerns. I hope you guys found this video helpful. If you have any questions, please don't hesitate to comment down below. Add me over on Instagram, and don't forget to click the thumbs up button and subscribe so that you guys don't miss out on any other videos. Thank you so much for watching, and I hope you guys have a beautiful day. Be kind to one another, stay positive, and we'll see you on the next one. Bye!